Thank you all for coming to listen to my presentation on sound disorders. When we talk about sound disorders, they could be from a wide range of reasons why a child is not intelligible, meaning we can't understand what they're unintelligible, meaning we can't understand what they're saying. But I'm going to focus because of the length of this presentation, I'm just going to focus on articulation disorder and phonological disorder. So when we're talking about those two disorders and we see a child demonstrating with sounds that are unintelligible, we have to decide why, what is the reason? I mean, what's the difference between articulation and phonological disorder? Well, when we talk about articulation, articulation means how the sound is produced. So we're talking about the speech mechanics, and the speech mechanics are your tongue, your teeth, your jaw, your lips, your larynx, your throat, your breath. All of those things have to come into play to make a correct sound. So people don't realize when we're making sounds that there's a lot that goes into making those sounds. And on top of that, there are three important things that you need to look at when you're making a sound. One is placement, one is manner, and the other is voice. With placement, the sound is made in whatever the location is in your oral cavity. So it could be made with your lips, it could be made behind your teeth, it could be made back in your throat. And the manner is, how are we forming that sound in our mouth? So we're using air, are we constricting the air so it's just a little going through? Are we letting all that air go through? Are we stopping it and making a little plosive there? And then we talk about voice, and all voices is that our vocal cords vibrate when we make voice, and if they don't vibrate, then we're making a voiceless sound. So that goes to phonological processes. Phonological processes are just the rules that govern our speech pattern system. So we have certain rules we need to follow, and with phonological processes, if those rules are not followed and it's at a time when we should no longer have those processes, then we are looking at a disorder. So I guess we could say the difference between articulation disorder and phonological disorder is that, again, with the articulation disorder, it's a phonetic or a motoric level. The child is having trouble making an individual sound. And with the phonological disorder, it's a difficulty organizing their speech sounds into a pattern. Now, when we look at articulation disorder, we need to identify placement, manner, and voice, but we also might want to look at we might want to do an oral examination. Maybe the child is tongue-tied, that their frenulum is that little tissue right behind your tongue. Maybe it's too tight and they can't raise their tongue. Maybe there's dental issues involved. So we have to look at that, along with some of our standardized testing that we do is we actually use pictures, and we're looking at how they produce that sound, and we're taking track of those sound production. We also look at a speech sample because we want to look at what they're doing, because articulation disorder could demonstrate with them adding sounds, omitting sounds because they can't make that sound, or distorting the sound. And we need to see, can they make that sound in isolation? Here again is a list of all the sounds we make, and if you look, this is the place we make them. Bilabial is your lips, labial dental is your lips and your teeth, interdental is between your teeth, that is that TH sound, and that's the sound we speech people like to say is the only sound you get to stick your tongue out with. And then this sound is right behind your teeth. I know that I'm doing a presentation and I'm a little nervous, so I'll butcher the name. I'll say alveolar. Palatal is right behind, it's the roof of your mouth, and the velar is right in the back. It's a k-g sound. And the glottal is like the H sound. And then over here is the manner, like I was talking about earlier. So here is an example of where you're making a stop, where you stop the air from coming out. So if you're making a P, you have to build the air up and stop it out. Fricative is you let a little air out. So it's just constricted air, like, and the affricate is just both. It's a combination of actually a stop and a fricative. We're stopping it and we're letting it out. And the last one is glides, and that's where the sound just glides right through, like an M, R, O. So if any of this area, there's displays they can't do the right placement or the manner of the voice, then we have an articulation error. We go to phonological disorder. Oh, and here is our norms. This is the other part of articulation and this is the Cave Creek School District. This is what we use kind of to follow through, is these are the sounds we need to see at 3 years. They need to have these sounds by 3 years old. If they are beyond this age and they are not making that sound, then we most likely have an articulation disorder that we need to fix. And this is what articulation disorder may look like. Like I said, if they're deleting sounds, we're making cat instead of cat. We're taking out that ending sound. Or they're substituting the sound because maybe they can't make a TH, so they're saying dree for three. Or they're adding a sound because they just can't get that blend in there, so they might say black for black. Or again, the distorted sound, and we see a lot of this, where they say thought for salt. So they might distort both the beginning sound and one of the medial sounds. So then if we look at phonological processes, this is again where I said it's naturally occurring to help us with our communication as we're developing it. So at 3 years, if after 3 years old, we see stopping or we see backing or fronting, then we know we have a phonological disorder, because these should all go away by this age. And by fronting is where they're to make a key, K for key, but they're making T. So that would be an example of a phonological process. Now, for phonological processes and articulation disorders, we do some therapy that can be similar, but when we're talking about a phonological process, these are some of our evidence-based interventions we may use. Minimal pairs, perceptual intervention, where we want them to think about that error, because if they're making an error with the sound, we need to show them that it's changed the whole meaning of the word they just said. Core vocabulary, we like to work on the vocabulary of whatever is age appropriate at that moment or what theme we're working on to help, and stimulability, so that if they're not making that sound in isolation, we're probably never going to get that into their repertoire where they'll actually start self-correcting. So these are really some of our best evidence-based interventions. And I wanted to talk about Carolyn Bowen, because when we're talking about minimal pairs, she has a wonderful website, and I do pull a lot of information from her website. And what she has said about minimal pairs treatment is that in the basically we need to emphasize the use of the sounds in the communication process. So whatever we're working on, we're using those sounds. And we're not focusing on them making an accurate sound, we're focusing on the contrast between the sound they're making and the accurate sound. So when I talk about minimal pair, all I'm talking about is we're taking one word and we're just changing one sound in that word, just one sound, one phoneme. So if a student is fronting a K, they're not saying cat. They're probably saying bat or tat. So I might have a picture of a bat and a cat, and I might do an auditory discrimination for them. So I might say bat, cat, touch cat. And if they touch bat, I'm going to say bat. Bat is something you swing in baseball. cat is furry. So again, I'm going back to conceptual information and that perception that they realize what they're saying is wrong and they need to recorrect it themselves. But basically, no matter what we're dealing with, if it's an intervention for an articulation disorder or an intervention for a phonological disorder, our main goal is that we generalize that therapy, whatever we're doing, that it's generalized into their whole environment and that we're promoting intelligibility into their speech. Thank you all for listening to my presentation.